Eyelid surgery is a way to remove excess skin from the upper lids. It also removes excess skin from the lower lids, but more often it's a repositioning of the lower lid margin and repositioning of the fat pads that are underneath the skin. Frequently we move them from an area of relative excess to an area of relative deficiency. The upper lid surgery can frequently be done under local anesthesia in the office. And that's well tolerated and much more simple. By comparison, lower lid surgery is more delicate and it has to go a little bit deeper into the compartments and generally requires general anesthesia in order to get into the fat pads and then just onto the bone and elevate that muscle so that we can move that fat into that area of relative deficiency. Upper lid surgery is probably necessary for the majority of us, unfortunately. Our skin does stretch as we blink about 6,000 times a day, and it frequently stretches to the point where it becomes excessive. Lower lid surgery is done for a different reason. You either have lower lid malposition, okay, because of laxity that develops, or the fat pooches out and it needs to either be moved to a more useful area or be trimmed so that you have a smoother contour. Lower lid surgery is frequently followed up by a laser resurfacing to improve the quality of the skin in that area as well. All right, so why is upper lid surgery done? It's done to remove excess upper lid skin. It's done to restore the natural crease contour in the well-hidden area of the recess of the upper lid. Again, easily done. Very simple procedure. We do lots of them in the office. The lower lid surgery is done for a different reason. It's usually for malposition and periorbital fat herniation. Both of them are really done to smooth the contour of either the upper lid crease or the lower lid area in general. Does surgery remove wrinkles? Again, no, surgery never removes wrinkles. The only thing that really removes wrinkles is laser resurfacing. You can remove excess skin, which contributes to wrinkles, but it doesn't change the quality of the skin that's left. It is the same as it was before. So the only way to improve the quality is to provide some contraction technique. Frequently, we employ laser resurfacing for that. How long does upper or lower lid surgery last? And the answer is, depends how fast you age. So upper lid surgery, again, almost everybody eventually will need it. It certainly can last a good while. I have done it. I know of some patients, I've done it 15 years ago, and they came back a couple years ago and had it done again. They did not look bad, but they just wanted to look more refreshed. So it is something that, again, is necessary to do because we all continue to age. Lower lid surgery can last a long time, especially if you have good supporting cheekbones. If you don't, however, the tissue tends to drag down because there's nothing to support it. It all kind of free falls. And so those people who have very flat cheekbones tend to age faster. And that's just the way they're made. So there's not much we can do about that except keep fighting the best fight we can. So upper lid surgery is frequently done, again, under local anesthesia. Patients can go home. They come back in a week. We remove their sutures, and they're off to normal life after that. Lower lid surgery takes a little bit longer. It's a little bit more invasive. It's a little bit more swelling and recovery. So it'll take maybe 2 weeks, 3 weeks to recover from the bruising and swelling. But once you do, it should be no problem. The pain level is usually minimal for either one. But you just look a little bit worse with lower lid surgery for a while. So oftentimes people ask, can I travel after surgery? And the answer is you can. You can certainly travel after upper lid surgery. It's no problem. You can do that from day one. Lower lid surgery, you can do that as long as you're not embarrassed by having the raccoon eye bruising or swelling. Different people react differently. So some people swell a lot, some hardly at all. So it's certainly up to you. There's no danger in traveling or flying, and it's up to you. As with all facial surgery, it is more advisable to sleep a little bit upright with a couple pillows. That helps resolve the swelling a little bit faster as swelling runs downhill. That should help you recover a little faster, but regardless, it should go away. I advise people not to wear contacts for about 2 weeks, either for upper or lower lid surgery. Dry eyes are also a theoretical consideration. If you do have dry eyes, please inform us so that we can make some appropriate changes in order not to worsen that condition. I don't recall that it's ever been a problem for us here. Thanks for listening to this video on eyelid surgery. Please like and subscribe and check out the channel for more videos like this.